In this presentation we will discuss about Newcastle disease. Newcastle disease is an infection of domestic poultry and other bird species with virulent Newcastle disease virus (NDV). It is a worldwide problem that presents primarily as depression, nervous manifestations, or diarrhea may be the predominant clinical form. Etiology. Newcastle disease (ND) is a member of the family Paramyxoviridae in the genus Evulovirus. There are 10 serotypes of avian paramyxoviruses designated APMVI to APMV10, and ND virus (NDV) has been designated APMV1. NDV has also been categorized into 5 pathotypes based on clinical signs in infected chickens, designated viscerotropic velogenic, neurotropic velogenic, mesogenic, lentogenic or respiratory asymptomatic pathotype groupings are rarely clear-cut. The original classification of NDV isolates into one of 3 virulence groups by chicken embryo and chicken inoculation as virulent velogenic, moderately virulent mesogenic, or of low virulence lentogenic, has been abbreviated for regulatory purposes. Velogens and mesogens are now classified as virulent Newcastle disease virus (VNDV), the cause of Newcastle disease and reportable infection, whereas infections with lentogens, the low-virulence Newcastle disease virus (LONDV), widely used as live vaccines, are not reportable. Epidemiology and transmission. Virulent Newcastle disease virus (NDV) strains are endemic in poultry in most of Asia, Africa, and some countries of North and South America. Other countries, including the USA and Canada, are free of those strains in poultry and maintain that status with import restrictions and eradication by destroying infected poultry. Cormorants, pigeons, and imported citizine species are more commonly infected with VNDV and have also been sources of VNDV infections of poultry. NDV strains of low virulence are prevalent in poultry and wild birds, especially waterfowl. Infection of domestic poultry with LONDV contributes to lower productivity. Infected birds shed virus in exhaled air, respiratory discharges, and feces. Virus is shed during incubation, during the clinical stage, and for a varying but limited period during convalescence. Virus may also be present in eggs laid during clinical disease and in all parts of the carcass during acute VNDV infections. Chickens are readily infected by aerosols and by ingesting contaminated water or food. Infected chickens and other domestic and wild birds may be sources of NDV. Movement of infected birds and transfer of virus, especially in infective feces, by the movement of people and contaminated equipment or litter are the main methods of virus spread between poultry flocks. Clinical sign. Onset is rapid, and signs appear throughout the flock within 2 to 12 days, average 5, after aerosol exposure. Spread is slower if the fecal-oral route is the primary means of transmission, particularly for caged birds. Young birds are the most susceptible. Observed signs depend on whether the infecting virus has a predilection for respiratory, digestive, or nervous systems. Respiratory signs of gasping, coughing, sneezing, and rales predominate in infections with low NDV. Nervous signs of tremors, paralyzed wings and legs, twisted necks, circling, clonic spasms, and complete paralysis may accompany, but usually follow, the respiratory signs in neurotropic velogenic disease. Nervous signs with diarrhea are typical in pigeons, and nervous signs are frequently seen in cormorants and exotic bird species. Digestive signs with depression, watery greenish diarrhea, and swelling of the tissues of the head and neck are typical of the most virulent form of the disease, viscerotropic velogenic Newcastle disease, although nervous signs are often seen, especially in vaccinated poultry. Varying degrees of depression and inappetence are seen. Partial or complete cessation of egg production may occur. Eggs may be abnormal in color, shape, or surface and have watery albumin. Mortality is variable but can be as high as 100% with VNDV infections. Well-vaccinated birds may not show any signs of being infected except for a decrease in egg production, but these birds will shed virus in saliva and feces. Poorly vaccinated birds may develop torticollis, ataxia, or body and head tremors 10 to 14 days after infection and may recover with supportive care. Lesions. Remarkable gross lesions are usually seen only with viscerotropic velogenic Newcastle disease. Petechia may be seen on the serous membranes. Hemorrhages of the proventricular mucosa and intestinal serosa are accompanied by multifocal, necrotic hemorrhagic areas on the mucosal surface of the intestine, especially at lymphoid foci such as cecal tonsils. Splenic necrosis and hemorrhage and edema around the thymus may also be seen. In contrast, lesions in birds infected with Londivi strains may be limited to congestion and mucoid exudates seen in the respiratory tract with opacity and thickening of the air sacs. Secondary bacterial infections increase the severity of respiratory lesions. Diagnosis. Tentatively, Newcastle disease may be diagnosed based on vital clinical signs such as a state of prostration and depression in the birds, with ruffled feathers, greenish-white diarrhea, and, in survivors, the head turned to one side, a condition known as torticollis is very often seen, as are paralysis of the legs, wings or other neurological signs. Serological tests. Hemagglutination and hemagglutination inhibition tests. Most widely used and detects antibody response to virus glycoprotein, predictor of protection against disease. Enzyme-linked immunosorbent assay, ELISA, as whole virus is used as antigen, detects antibody to all of the virus proteins. Commercial ELISA kits available to assess post-vaccination antibody levels. Control and prevention. The general approaches to the control of Newcastle disease are hygiene and vaccination. This is always important, especially in the control of Newcastle disease in semi-intensive systems where birds are confined within a fenced yard or house. Hygiene includes measures such as cleaning, disinfection, limiting access to wild birds, and personal hygiene of the farm staff. Vaccination in combination with appropriate hygiene measures, this remains the most effective way of controlling Newcastle disease. Vaccination against Newcastle disease would result in immunity against infection and replication of the virus. Realistically, Newcastle disease vaccination usually protects the bird from the more serious consequences of disease, but virus replication and shedding may still occur. Vaccination. These different approaches to vaccination have been applied to Newcastle disease. There are 3 types of vaccines used for Newcastle disease: live lentogenic, live mesogenic and inactivated vaccines. Live lentogenic vaccines are usually derived from field viruses that have been shown to have low pathogenicity for poultry but produce an adequate immune response. Typical vaccine strains are HB1, Lasota and F strain and some viruses from the asymptomatic enteric pathotype, which are usually based on the V4 or Ulster 2C viruses. Vaccine application. Mass administration methods. In intensively developed commercial poultry industries, an important cost of vaccination is the administration. For this reason, mass application methods have been developed, primarily for live vaccines. Various forms of equipment are manufactured to generate coarse sprays, which allow mass application with minimum adverse reaction, although in some circumstances, mass application by fine sprays and aerosols are employed. Application of live vaccines via drinking water is still employed in some areas, although in the commercial sectors, this gives some problems in preparing and cleaning the drinking water system, with a tendency for a less than uniform uptake. Eye drop administration. Application of the vaccine by eye drop methods is probably the most effective for live lentogenic vaccines. Administration of the vaccine via drinking water. Vaccination by placing the live vaccine virus in the drinking water is easier than application to individual birds, but it provokes a lower level of immunity than eye drop administration, has less uniform uptake and requires more frequent application. The vaccine should be given twice, initially 2 to 3 weeks apart, with revaccination at least every 3 months. Oral administration. Oral vaccination of chickens with thermostable vaccines, i.e. NDV4HR and I2, has been successful in some developing countries. Administer by oral drench dissolved vaccine squirting into the beak of each bird using a clean plastic syringe. Administration via injection. Inactivated Newcastle disease vaccines are administered by intramuscular or subcutaneous injection only, in the breast or the leg. Inactivated vaccines should be allowed to reach ambient temperature, approximately 28 degrees Celsius, and the contents should be well shaken prior to use. If stored in a cool, dark location, an inactivated vaccine may retain its activity for 1 to 2 weeks outside a refrigerator. Inactivated vaccines are more effective in chickens which have previously received a living vaccine. Revaccination is usually done every 6 months. By this we are coming to end of today's program. Subscribe the HVS channel. Thank you for watching.